Hi, hello everyone. Welcome to Apothecary Tales, the basics of pharmacology. So today we're going to go with the second part of the question discussion. So let's quickly look into it. The first question is, how does metformin act? The option A blocks absorption of glucose in the intestine. Option B increases pancreatic insulin secretion. Option C increases hepatic glucose production. Option D increases metabolism of ketone precursors. First of all, which class is metformin belonging to? It is belonging to biguanides, which is the insulin sensitizers. Since it is insulin sensitizers, they do not have any specific role in releasing insulin. Rather, they predominantly lower the glucose by inhibiting the hepatic gluconeogenesis and thereby opposes the action of glucagon 2. Therefore, it helps the cells of your body to absorb more glucose from the bloodstream. And that is the basic mechanism of action of metformin. Therefore, the answer to this question is option C. It decreases hepatic glucose production, thereby helps the cells of your body to absorb higher levels of glucose from the bloodstream, thereby helping to treat hyperglycemia. The second question is, which drug is used to prevent haemorrhagic cystitis in patients receiving cyclophosphamide? The options are methotrexate, mercaptopurine, dacarbazine, mesna. First of all, which class is cyclophosphamide? So it is the antineoplastic agent belonging to alkylating class. So why do we have to give a drug to prevent hemorrhagic cystitis in patients receiving cyclophosphamide? First of all, the cyclophosphamide gets converted to acrolein, a metabolite which is capable of attacking the bladder mucosa. By damaging the bladder mucosa, it leads to the hemorrhagic cystitis, which is basically the bleeding from bladder mucosa. So, among the options given here, the apt option would be mesna, because mesna is usually inactive in nature, which has no antineoplastic activity, but it gets active in the urine. It is capable of binding with this acrolein, which is responsible for affecting the bladder mucosa and thereby causes the faster elimination of acrolein from the body. Thereby reduces the chance of hemorrhagic cystitis caused by cyclophosphamide. So therefore the answer for this question is mesna. The next question is, which penicillin is effective in the presence of penicillinase enzyme? The options are moxilin, flucloxacillin, phenoxymethylpenicillin, ticarcillin. First, let's understand what is penicillinase. It is this enzyme which is usually responsible for the breakup or the degradation of the beta-lactam ring present in the penicillins. So these enzymes are generated by the bacteria as part of mutation. So which among the different options would be effective in the presence of penicillinase means it is resistant towards this enzyme. So option A, amoxicillin? No, because it is a semisynthetic penicillin which is sensitive towards the penicillinase. Option C, that is phenoxymethylpenicillin. It is also known as penicillin V. It is belonging to the natural penicillin class. Option D, ticarcillin. It is anti-pseudomonal penicillin class, which is also sensitive to the penicillinase enzyme. So the option B, that is flucloxacillin, which is anti-staphylococcal penicillins, and the other penicillins belong to the same class include methicillin, oxacillin, nacillin, dicloxacillin. Once again I'll repeat, they are belonging to anti-staphylococcal penicillins. And this class of antibiotics, that is anti-staphylococcal penicillins, are usually resistant to beta-lactamase enzymes or penicillinase enzymes and thereby is found to be effective in the presence of penicillinase. So the correct answer for this question is flucloxacillin. Moving on to the next question. Patients are most likely to develop acute gout when treated with which one of the following? The options are colchicine, losartan, spironolactone, furosemide. So when we have to deal with these kind of questions, first we have to understand if it has to cause acute gout, let's see what are the possibilities of these drugs to cause hyperuricemia, because elevated levels of uric acid contributes to the development of gout. So first option, colchicine. Colchicine is a drug that is responsible for the treatment in gout because it prevents the microtubule formation and thereby reduces the generation of leukotrienes and cytokines, which is responsible for the gout. So therefore, definitely colchicine is not the answer. Option B, losartan. Losartan belongs to the angiotensin receptor blocker. And the angiotensin receptor blockers are known to decrease the serum uric acid concentration. So therefore, it will not contribute to the development of gout. The third option, spironolactone, which is aldosterone antagonist drug. There are reports saying that it interferes with the renal uric acid clearance, particularly in patients with kidney problems. So there might be a chance of developing acute gout, especially in renal compromised patients. What about the fourth option? Furosemide, which is belonging to the loop diuretic. Loop diuretics are known to have the significant ADR, that is hyperuricemia. It contributes to the elevated levels of uric acid because the furosemide decreases the urinary excretion of uric acid. Therefore, among the options given here, the most apt option would be furosemide. The last question of this part is, which one of the following agents is a selective dopamine D2 receptor agonist? The options are bromocriptine, promethazine, haloperidol, chlorpromazine. Promethazine, the option B, is an antipsychotic belonging to the class phenothiazine. Promethazine being an antipsychotic, we have to understand that antipsychotics mainly act as a dopamine antagonist because psychosis usually happens due to the excess levels of dopamine. Therefore, we give antipsychotics which will block the action of dopamine at the respective receptors. So therefore, promethazine is not the answer. What about haloperidol? Haloperidol is also an antipsychotic belonging to the chemical class butyrophenones. So, being an antipsychotic, this is also dopamine antagonist. The last option is chlorpromazine. This is also an antipsychotic belonging to the same class of promethazine, that is phenothiazine. As a result, option B, C, D all are belonging to the antipsychotics, which is going to act as dopamine receptor antagonist. Now, going to the first option, bromocriptine. Bromocriptine is the right answer because it is dopamine receptor agonist. It acts at the dopamine receptors and increases the action of dopamine. And this is one of the useful drugs in the treatment of Parkinsonism. Because in Parkinsonism, we know that there is a declined levels of dopamine. So therefore, giving dopamine agonist would help treat the symptoms associated with Parkinsonism. So the option here, or the right answer here, would be option A, bromocriptine, which is the dopamine receptor agonist. With that, today we wind up our question discussion. I hope these 5 questions are clear to you. I'll come up with new questions in the next video. Thank you and have a nice day.